This presentation is on OHP Dental. This is part of our webinar module series with the presenters Dina and Tanya. So let's get started. All right. So as we get started with this presentation, we're going to cover a lot of topics. So there's a few high-level things that we just want to remind everyone about. The first is that all OHP members have dental coverage. I think oftentimes OHP members they focus on the medical part of it and forget they have dental coverage. So we encourage you to remind folks that they have dental benefits. The second thing is that dental health is important to overall health. It's not just about keeping your pearly whites bright and shiny, but it's about keeping your whole body healthy, and dental health is a very important part of that. The third thing to keep in mind is that dental disease is preventable and it is manageable. So whether someone has existing dental concerns or is trying to prevent them down the road, it's important to keep dental at the forefront throughout the whole life cycle.
All right, so today we will be talking about the 3 ways to get dental coverage, dental care organizations, appointment timeframes, covered benefits, finding and changing plans and providers, and additional resources.
All right, so the first of 3 ways that a member can get dental coverage. One is fee-for-service with the state. This is also called open card. 1 second, just turning off my webcam. So open card, we don't really have time to get deep into the weeds of what open card is, but the gist of it is that it's when a member is not enrolled in a CCO and they are fee-for-service. Fee-for-service means that OHA pays directly for their care. There are many reasons why a member might be fee-for-service, and while we won't get into all of them, some of them might be a member is American Indian or Alaska Native, they have coverage under Child Welfare or Oregon Youth Authority, and a myriad of other reasons.
All right, the second way to get coverage is through an assigned CCO or coordinated care organization. So CCOs provide members dental coverage using different dental networks. Some CCOs only use dental plans, also called DCOs. We will explain what a DCO is in a little bit. Other CCOs offer dental coverage using a mix of dental plans and community providers such as federally qualified health centers, FQHCs. One thing to note here is that some CCOs assign a member to a dental plan, straight away, while others let a member choose first. When there's more than one dental plan, the member has a choice and can switch plans.
All right. And the third way that a member can get dental coverage is by being assigned by the state to a direct contractor, DCO. So similarly to how a CCO member would get assigned by their CCO to a dental plan, if a member does not have a CCO, the state may assign them to a DCO. We'll explain a little bit more in the next slide.
All right, so like we said before, we'll talk about dental care organizations or DCOs shortly, and here we are. So a DCO or a dental care organization is a Medicaid dental insurance plan that is made up of local dentists and specialty dental providers. The dental care organization, or DCO, coordinates dental care for its members. DCOs contract with local dentists and specialty providers to make up the DCO's network. Each DCO has a different network, so not all dentists and specialists will work with each DCO.
All right, and across the state, there's several different DCOs. Based on your region, you might recognize some of the DCOs that are listed on this screen. In some regions, there's just one DCO. In some regions, there might be more than one. In instances when there's more than one DCO in the area, members have options from which to pick from. If the member does not make a choice, sometimes they will be auto-assigned to a DCO. And as I mentioned, since they're all in different areas, not all serve every area. And an OHP member can choose which one better suits them. And so we encourage members to get in touch with the DCOs in their area if they have questions or if they want to get to know a little bit more when trying to make a choice.
And I just want to reiterate there, Tanya, that the PDF of the presentation is in the attachment. So all of this contact information can be found there for your convenience.
Thanks, Dina.
Thank you. So finding or changing a dental plan. So CCO members, they can check ID cards to see who the assigned DCO is, or contact the CCO if the DCO is unknown. Now, for non-CCO members, so fee-for-service or open card, they can contact OHP Client Services at the number on the screen of 1-800-273-0557. A few things to note here. So if there is more than one dental plan in the member's region, they can change to another dental plan that is accepting new members. But members can only change their DCO once per year, unless they move. So each DCO has a website with a provider directory and other information. So before becoming a member, a potential member can call any DCO to ask questions such as, which providers close to me are open to new patients, or which see young children, or is my dentist in your plan? DCOs offer all kinds of assistance to members, such as help finding a provider, care coordination, and much more.
All right, so that was how to find or change your dental plan. Now we're going to talk about how to find or change your dental provider. And when we say dental provider, that includes things like dentists or dental hygienists. So if a member has a CCO, they have a couple options for how they can find or change their dental provider. The first is calling their DCO or their dental plan listed on their ID card. The second way is that they can contact their CCO if they don't know who their DCO is. So if a member is not quite sure who they have, the CCO is always a good choice. That's a good first step. Another option for non-CCO members or members who are fee-for-service or open card, they can call the OHP Care Coordination line, the number on this slide, and they have a team that's able to support finding a dental provider and helping non-CCO members navigate their dental coverage. And a couple other things to note, some DCOs assign members to a primary care dentist, others do not. So it really depends on what dental plan a member has, whether they're auto-assigned or they have to make that choice on their own. Dental plans or DCOs can advise a member on how to get access under their plans. And if a member wants to change their dentist, again, they should just speak to their dental plan to get help with that.
Awesome, thank you. So appointment timeframes, this is important to note. According to Oregon administrative rules, a member should be able to access care within specific timeframes. So the appointment timeframes that are listed here, for emergency dental care, a member should be seen within 24 hours. For urgent care, they should be seen within 1 week. For pregnancy care, they should be seen within 4 weeks. And for routine care, they should be seen within 8 weeks.
Okay, so one of the time frames that Dina mentioned was for emergency dental care. And so we just want to clarify what a dental emergency is to ensure that when you're working with the client, you direct them to the right place. A dental emergency can be things like bleeding from the gums or teeth that does not stop, swelling or infection of the gums or mouth, a tooth that has been knocked out, or severe tooth pain. For OHP members, emergency oral or dental care is available any time of the day or night. An emergency is a serious problem that needs immediate care, and we want to make sure that members are seen in the right place for dental emergencies. Now, what is the right place for a dental emergency? Some people use the hospital's emergency room as the go-to for everything, but when it comes to a dental emergency, the right place is at a dentist's office because they are specially equipped to handle emergencies of the teeth. And while emergency room professionals are great for life-threatening conditions and can provide care there, they're not as equipped to handle emergencies that are dental related. So if a member is having an urgent or emergent dental care need, even if their office is closed, they should still call their dentist. And things that are better equipped for a hospital or emergency room, those are things like jaw fractures, dislocations, serious cuts or lacerations. But again, things related to teeth that are seen with a dental provider.
Perfect. Thank you, Tanya. So emergency and after hours care. So a dental emergency, if they're in the case of a dental emergency, excuse me, please encourage members to call their dentist first if there is one. And what if it's after hours? Right. So if it's after hours, they can contact the dentist still in an emergent or urgent dental care need. And if you get an answering machine, be sure to leave a message with details about the issue and you'll get a call back. You might also get instructions for how to talk to your dentist in an emergency. So we want to make sure that members are calling the dentist straight away. And if they don't have a dentist or they're not hearing back, they can call the dental plan if they are assigned to a dental care organization or DCO, or they can contact their CCO, coordinated care organization. For those on fee-for-service or open card, they can call the 24/7 nurse advice line on the screen at 1-800-562-4620. And if it's a true emergency, like bleeding that won't stop, please go to the emergency room. And encourage members to get set up with a dentist long before an emergency happens, so that if the emergency does happen, they will have hopefully a primary provider or at least know which clinic they can go to.
All right. So what are covered benefits? So then OHP members have a set of benefits that are covered, things like exams, cleanings, x-rays, basic restorative care, and more. And we've included a list of some of these benefits on this slide. It's important to note that a lot of benefits are based on dental necessity. So some of them might require an approval or a referral. If you have specific questions about what a member has covered, the dental plan is a really great place to start, and they have teams that are equipped to help answer those questions. There are also limits to care based on how old someone is or if a member is pregnant. So for example, with an exam or a cleaning, an exam is covered once per year for adults, but for pregnant women or members under 21, there are 2 exams each year. So these benefits are also included in a member handbook, or you can speak with the dental plans. At the end of this presentation, we're going to cover member handbooks a little bit more, and we'll show you where you can find that.
Great, thank you. So care coordination. Dental care organizations are there to help manage member dental care needs. So many CCOs partner with dental care organizations to manage the members' dental care needs. They can help members find dentists or schedule appointments, as well as coordinate dental services such as oral surgeries. If a member has been assigned to a DCO, they should start there if they need help. DCOs have dental case management teams that are there to support members who need the extra help. And DCOs can also help any member, even if it's not a member that is assigned to them. So if a member is not getting the help they need from their DCO, they can contact their CCO and/or Oregon Health Authority, OHA, directly for help and or to file a complaint. They can also file a complaint with the DCO if they are unhappy with the dental plan or the primary care provider, or primary care dentist, excuse me.
All right, thank you, Dina. And so finally, we're going to share some additional resources that you can use as you're working with clients to help get them information. So the first really important resource that you have is member handbooks. So here in the slide, we've included a link to member handbooks. The OHP handbook is just the overall general member handbook that has information about a member's physical, behavioral health, and dental plans, and other resources available to all OHP members. If a member has a CCO, the CCO will mail them a member handbook, and it's also available on the CCO's website. That member handbook has information about the member's dental benefits under that CCO. If a member does not have a CCO and they are enrolled in a dental plan, they have a member handbook with that dental plan specifically, and that can be accessed on the DCO's website. If a member wants a copy of that member handbook, they can reach out to either the CCO or the DCO and either download it from their website or get a printed copy mailed to them in a language or in a format that works best for them. Another resource is NEMT, or non-emergency medical transportation. This is a benefit available to all OHP members for their appointments, whether that's dental or for physical or behavioral health. They have access to free transportation if they need it. So here we've linked a resource that has all of the transportation services available by region. So each region has a different service, and it could also vary based on if a member is enrolled in a CCO or if they're fee-for-service. So as you're working with members, we encourage you to get familiar with the NEMT service in your region so that you can help guide members for how they could get connected. The CCO should also be able to assist as the DCO, and they can help guide a member when they're scheduling appointments. The third service that's available to members, OHP members, is no-cost interpreter service for their appointments. This is true for physical appointments, but it's also true for dental appointments. So if a member needs an interpreter at their dental exam, they are welcome to have one free of charge in their preferred language, and the DCO or their CCO can assist with getting that scheduled. So if you have a member that speaks a second language that would prefer to have interpreter service, please encourage them to use this because it's a free resource available to them. And I think that just about covers our content that we wanted to share with you. I know we went through a lot of that information really quickly. So if you have any questions related to any of the things that we've shared, if you want us to go back to a slide and share that information again, we are happy to. As a reminder, Dina mentioned that we have these slides available on this webinar, so you're welcome to download those as well.
Thank you, Tanya. So yes, now we have time for questions. I'll go ahead and read off the really good questions. I see there's a couple in the chat box. The first one is, are the timeframes still in effect with COVID?
That's a great question. Yes, the timeframes are still in effect with COVID. And if you find that a member is having trouble getting seen within the appropriate timeframe, please give the DCO or the dental plan a call, whether that's ODS or Advantage or Capital. If a member is struggling to get care within the timeframe, call the DCO. And if you aren't having luck with the DCO, bring it up to the CCO, file a complaint. Complaints are really important, not just, I know some people hesitate to file a complaint because it sounds complainy or negative, but it's a way for us to track what's working and what's not working and help escalate things and track things. So yes, stand up for your members, encourage them to get care within the timeframes that they're entitled to care.
Perfect. I think you answered the next question of what if they never answer? And I believe that was in regards to contacting a dentist or provider in any case, hopefully, but in case of emergency or urgency. And like Tanya said, I would contact the dental plan straight away if that does happen.
Mm-hmm. Yeah, if the providers, sorry, Dana.
No, please.
If a provider is not answering the phone within their business hours, or even if they don't have like an out of office message like outside of hours, like a member should still be able to get care or be connected to care after hours. I would strongly encourage you to contact the dental plan and let them know that this is going on.
Awesome. Thank you, Tanya. We have another question. If we have billing questions related to dental, can you share a contact number?
Yeah, if it's with a member that has a DCO, you can contact the DCO. And let me go back to that slide. Okay. If the member has a DCO and is having billing issues, the DCO should be able to help. So I would give them a call. If you don't know the DCO, give the CCO a call. And if the member does not have a DCO, then I would call Client Services Unit.
Okay. Any other questions? Please feel free to put them in a chat box, and we will be sure to try and answer them. Give it a couple of minutes or a minute or two, Tanya, in case questions come in.
Sounds good. Thanks, Dina.
Or perhaps if there's any slide or information you want us to go over one more time or talk about more. Oh, here's one. What do we do if the CCO doesn't want to share DCO information with us?
That's a good question. I've been working on getting clarification from the CCO or from the CCOs if they're willing to share that information. I'm not 100% sure if all CCOs are sharing that information, but that's something that I've brought to the dental plans to let them know. I have found that the DCOs are usually really willing to help. So if you give the DCOs a call, they will usually be able to share information with you, simple information. If you're able to provide the member's date of birth and prime number, they will usually be able to share what DCO the member has. So you can try that way. But I am working on getting a little bit more clarity from the CCOs about what they can and can't share. And once I get that, I'm happy to provide that information.
Yeah, there was a continuation of that question saying that sometimes I've been told only the client can ask.
Yeah, and I've heard mixed things from the DCOs and the CCOs on that. My understanding was that the DCO should be able to tell a CP which DCO a member has. But again, I'm not 100% sure. So I will double check with the dental plans on that.
Ready for the next?
Mm-hmm.
How often can a member change from a CCO to open card and back again?
You know, I don't know off the top of my head. I could take that back.
So as far as I know, they can't necessarily change to an open card just because they want an open card. They have to have qualifying factors like the ones that Tanya mentioned about being native. And sometimes they're on open card when they've moved for a couple weeks until they are placed with a CCO in the region. So as far as I know, and we can give more information on this, it's not necessarily an option for them to be able to change as they wish from CCO to open card, unfortunately, without meeting qualifiers. Okay, next question is, can DCOs tell us if a client is their patient, or if the client belongs to another DCO?
Yeah, I think I addressed that one. That there's some DCOs that are consistently able to provide that information, and I've heard that there might be one or two that don't. So I'm talking to the dental plans to just get a consistent answer on that, and I'll share that later.
Great, thank you. Yes, that was a continuation from the same person. Sorry about that. That was my bad, Tanya.
No worries.
The next question is, can a member be open card for dental only and CCO for medical? I have not heard of an instance like that, but we might need to look into it further, Tanya.
Yeah, I think we need to double check on that one.
Okay. And
okay, I can answer that next question. Yeah, so it says, my coworker called the nurse helpline for a list of dental providers for Cowan Plus members in Lane County and was told that they don't have a list of providers. So for that, I would suggest calling again. So we were recently told that the team that works the nurse advice line during business hours is usually able to find a list of providers, usually has access to a list of providers. But if you call after hours, they worked with some contractors that don't have access to that same list. So I would say if you're having trouble getting a list of dental providers from the nurse advice line, try calling again during business hours. Let's see. So the next question, oh yeah, someone had a comment that said they have tribal patients who have medical open and dental CCO. So thanks for sharing that.
Awesome, thank you.
If a dentist will only see a fee-for-service only, can a member be open card for continuity of care? My understanding is that open card, that being on open card is sometimes done on a case-by-case basis. And Dina, I don't know if you have a bit more information on that.
I don't at this time. I'm sorry. I would have to look into it a little further.
Yeah. We are also working on creating a training that's specific to fee-for-service, since I know that's a whole other complicated world, and a lot of RCPs are asking questions related to that. So we will keep you posted on when there's a fee-for-service specific training module, because I think it would be really helpful to have a bit more information on that. But we will take back these questions and contact you with answers.
Awesome. Any more questions?
Yes, and these slides, if you look in the handout section of the webinar, we have a PDF that you can download with the slide information. And I know we covered information on each slide that wasn't on the slide itself. So if you want a bit more notes on a specific slide, we're happy to send that out as well. Just reach out to us. Yeah, and actually I'll put my email in the chat. So if anyone has follow-up questions, you're welcome to reach out to me and Dina. And if you want to put yours in there as well, you can reach out to one or both of us and we can get back to you.
Yep, I'll put mine in now.
Perfect. Thanks, Dina.
Okay.
All right.
Any other questions before we finish today's webinar? Well, thank you for your time and attending and for trying to gain more information to assist members. I appreciate the work you all do, and we will definitely work to get the answers to your questions and follow up with you. And in the meantime, if anything comes up, please reach out to myself and or Tanya We work together as a team, and we'll be sure to help where we can.
Thanks, Dina. Just reiterate what you've shared, and yeah, I appreciate all of you for being here. Have a great rest of your day and week. Bye, everyone.
Thank you.